Good day everyone. Today we're going to discuss what is all about the genital herpes, treatment, the etiology, the signs and symptoms of this infection.
Genital herpes is one of the most common STIs in the world.
So our topic is about genital herpes. So what is genital herpes?
Would you know if you had genital herpes? You might think so, but the truth is, many people don't have any idea they have this sexually transmitted infection. Some people don't have any symptoms at all, but when symptoms do appear, they can be painful and frustrating, not to mention highly contagious.
So according to new research, genital herpes is a common sexually transmitted infection caused by the herpes simplex virus. Sexual contact is the primary way that the virus spread, according to Genital Herpes Symptoms and Causes 2020. So, as mentioned, herpes is a disease caused by two types of herpes simplex virus or virus. Yeah. So, yung genital herpes is a type 2. Yung type 1 is ito yung generally responsible siya sa cold sores and fever, blister around the mouth at sa muka. Ngayon, madalas naman itong or it also referred to as oral herpes. So usually contracted to siya by kissing and pag-share ng mga gamit na sinusubo sa mouth. Na pwede rin makakause ito ng genital herpes. So yung type 2 naman is itong genital herpes. So itong genital herpes causes blistering sores sa genitals na usually contracted siya through sexual contact na pwede rin ma-infect through the mouth. So, yung causative agent nito, as I mentioned, is the herpes simplex virus. So, the type 1, which is the oral herpes, and type 2, which is the genital herpes. The mode of transmission of genital herpes naman is, as mentioned kanina, is the direct contact with the infected skin and mucous membrane or to childbirth. So therefore, itong infection na to are transmitted through contact with HSV or herpes simplex virus in herpes lesions, mucosal surfaces, and genital secretion or oral secretion. So, yung transmission na to commonly occurs siya from contact with infected. Kaya nga, direct contact, diba? So, contact with an infected partner na walang visible lesions or dun sa hindi alam na infected na pala sila. So, ayan. So, the incubation, yung average incubation period dito for the initial or the primary herpes infection is 4 days or it range 2 to 12 days after nung exposure dito sa or yung contact with the infected person. So, ang period of communicability dito ay during or up to 7 weeks pagkatapos ng initial or nung primary lesion. Then, doon naman is sinisira niya yung mga vesicles or it break the vesicles and nang-iwan siya ng painful ulcer na that it may take 2 to 4 weeks para mag-heal after nung initial infection.
So the next is the sign and symptoms. So localized visualized lesion at the area of the contact but may spread to surrounding tissue or disseminated in the body. So if you have the genital herpes, may occur the pain and itching or masakit na pangangati sa iyong katawan. The small bump or blister around the genital, most especially sa anus or your mouth. So magkakaroon ng pain or ulceration heal that can cause of irritation to your skin. Next is magkakaroon din ng painful sa iyong urination. So during your urination, masakit ang iyong pag-ihi. It is because of this infection. So next is the discharge from the urethra or the tube that release urine from the body. So magkakaroon din ng infection sa inyong pag-iihi or magkakaroon ng error. It is because of that infection is very severe na. So the next is the laboratory test or screening of this infection. So the first laboratory test of this infection is the serological test, and the next is the isolation of the virus from the lesions or tissues biopsy specimen. So those are the laboratory tests or screening tests of this disease. So the next is the treatment of this infection. So most especially, according to the study, the most popular treatment of this infection is the antiviral agent. So this antiviral agent kasi it has a power to fight the infection in your body. So ang antiviral drugs are different from the antibiotics, which is fight against the bacterial infection. So this is antiviral drugs for flu only work to treat the flu. So the flu is the antiviral drug that are different from antiviral drug used to treat other infection disease or such as a COVID-19. So magkaiba yun siya. So this is the treatment of this infection is the antiviral agent.